Live from Studio 5 in New York City, this is the News at 6.
And joining us live in Studio 5 to talk about how you can look your personal best is world-renowned plastic surgeon, plastic and reconstructive surgeon, Dr. Darrick Antell.
Thank you.
Thanks so much for joining us.
My pleasure.
Now, Dr. Antell, not everyone is automatically a good candidate for plastic surgery. Is that true?
Well, that's true. When we talk to a patient, we try to assess their expectations, see if they're realistic, and if they've really thought it out well.
Okay, so once you've thought it out well and you're clearly, mentally ready to make a change, subtle differences can actually change a person's outlook, their confidence, their whole lives. Is that what you've seen?
It's remarkable how much better people feel. I've seen people come to consultations, and they'll be looking at the floor, they can't quite look at you, and then afterwards, after the surgery, their chin is up. And it's obvious they feel better about themselves. They carry themselves better.
Now, you've done a lot of studies and research, and some of your research that you've read, we're talking about how someone's confidence, their overall attractiveness can land them a better job, higher salary, more confidence. Tell us.
Well, one of the studies that I did was on the CEOs of the Fortune 500 companies. Now, we know that they tend to be tall, good-looking people, but we looked at their chins, and we found that they tend to have a stronger chin than the average population. It was really quite interesting.
A stronger chin also makes for a better profile, because a lot of people think you're looking straight on, but people are always moving and you see different angles. So something as small as a chin implant, you're saying, can change someone's overall appearance?
Indeed, and if you look at someone like Arnold Schwarzenegger or Brad Pitt.
Like right here. Well, this is a big change.
Indeed. Both of these people have a stronger chin, and the area under the chin can be cleaned up also. Sometimes as people age, they get some fullness there. Now, those pictures are identical twins that are up. And the one on the far left is the one that had different lifestyle choices, like smoking or excess sun.
That's interesting, because it's not just genes, it's what you can do now. So let's talk about what we can do now, because some people say, I'm going to get plastic surgery when I'm 50, but actually you can get little procedures along the way. It doesn't have to be a wild whirlwind experience where you look like someone completely different.
Well, even before procedures, it's preventative medicine. So watching what you eat and getting good sleep, avoiding sun, smoking, all the stuff that Mom always said. But when it's time for procedures, there are little things we do, like injectables, Botox, fillers. They can make a very big difference with a minor procedure and no recovery.
I'm seeing even 20-year-olds saying they're getting Botox. When's the ideal age to start, or is there one?
Well, I think some people view Botox today as something that you can do, like getting your teeth cleaned, to prevent a problem. So particularly over here, people tend to get what we call a number 11 sign.
I'm starting to work on one right
now. Well, one person said to me, it was Harry Smith, he was getting up to 13 already.
Yeah, well, especially once you have kids. That's when it starts, right?
That can happen. But it relaxes you. Some people have found that it makes headaches go away, too.
Oh, with migraines.
Yes, exactly.
I read some research on that.
Yeah, it's like aspirin, one of those drugs that has so many uses.
And it's accessible to so many more people now. Tell me, what's the one feature on a face, if altered, could make the most difference?
Well, it depends on the person, but when we analyze them, we try to find that one thing that maybe is just out of alignment. It's as though you walk in a room, and if a picture is crooked in the room, you just straighten the picture and the whole room looks better.
Right. Have you ever had someone walk in and you just said, you're too beautiful, there's absolutely nothing to change here, or can everyone still look better?
I have had that happen, where I've said to people, I'm not sure I can make you any better. There's also a risk-reward ratio. Sometimes they're just looking for something small. There are people that are in very competitive jobs today, and it's extremely important how you look. Not only if you're on camera, but even in the workplace. People do judge the book by its cover.
Especially with all the selfie promotions and culture we're going on. Everyone looks beautiful these days.
And it's instant. You can go to a wedding and someone takes a picture of you at the buffet table, and you realize that maybe there's a little extra under here.
That's how most people probably find out.
Yes, and then they go online and they get more information.
All right, and you're helping to make the world a more beautiful place. Dr. Darrick Antell, thank you so much.
Thank you very much.
So Antell-MD.com.
That's correct.
All right, perfect. Thank you. All right, coming up, wearables are where it's at when it